I know people will continue to walk in. Each year, we have the annual AOA lectureship, and this lectureship is special because the students themselves pick the lecturer. And so no faculty member using their pressure or whatever decides on who the speaker will be. The students look out nationally or internationally and pick someone who has developed their own reputation that's interesting to the students for whatever they do, and the students bring that person by invitation here. And this year we have a very special person who spent the whole day with the students today, and I'm going to let our president of AOA, Ernest Young, introduce him to you.
I'm sorry, I'm going to have to read from this paper because Dr. Gunderman is really a distinguished professor, so it's kind of long. So Dr. Gunderman is a professor in radiology, pediatrics, medical education, philosophy, liberal arts, and philanthropy at Indiana University. He did his undergraduate studies at Bosch College, and he got an MD, PhD from the University of Chicago. He also holds a Master's of Public Health from Indiana University, and he has an honorary doctorate of Humane Letters from the seminary at Northwestern University. He's a 9-time recipient of the Indiana University Trustees Teaching Award, past president of the faculty at Indiana University, and in 2008 he was named Outstanding Educator by the Radiological Society of North America. And then the American Radiological Society named him the 2011 Berlin Scholar in Professionalism, and 2012 Distinguished Educator. And last November, the AOA awarded him the Robert G. Glazer Award for Teaching Excellence, which is the highest teaching award given by the Association of Medical Colleges. And he's authored more than 340 articles, 8 books, and I'm glad to have him here today to talk about have we forgotten the meaning of professionalism? So, Dr. Richard Gunderman.
Thanks a lot, Jeff and Ernie. It's a treat to be here. I hope you'll find this presentation provocative. I think professionalism is a theme we hear a great deal about, but something I think we need to revisit and perhaps consider from new vantage points. I might want to say a little bit more deeply. I can't pretend that I'm going to offer a reflection of that depth, but we'll see if this stimulates some thought and conversation that you find illuminating. So what does the word professionalism mean? Well, I've actually been to national meetings, national medical meetings, where people have given talks on professionalism, and, you know, they've talked about things like, you know, do you tie your tie with a double Windsor knot, you know, or is it okay to have a tattoo or a body piercing, or, you know, should you button your jacket when you sit down or not? And, you know, that seems to me like a pretty superficial understanding of professionalism. That's like, do you look professional? Now, in a sense, we all want to look professional and perhaps should, but surely our conception of professionalism should go far deeper than what we look like. In other words, professionalism isn't a costume that you don, you know, when you walk into the hospital at the morning and then leave hanging on a rack when you leave. I mean, presumably it's something we would hope to exemplify not only when we're at work, but I would think all the time. What and who we are as professionals should shine through in practically everything we do. Mark Twain said, "Clothes make the man naked, people have little or no influence on society." Well, what and who are we in our nakedness? I don't mean when we're disrobed, but I mean naturally, fundamentally, authentically. What and who are we? Our professionalism, our profession, the degree to which we're professionals, it seems to me, should be bound up with that. Maybe even emanate from that. Who created that image? What? Toulouse-Lautrec, that's right. Who are those people? They're professionals, right? Practitioners of the world's oldest profession. I mean, that's A, factually wrong, but B, highly injurious. What kind of a conception of professionalism does that embody? What's a professional on that account? Somebody who gets paid, right? Play tennis, play golf. Are you an amateur? Are you a professional? To be an amateur is to be some kind of second-class citizen, right? Wrong. You know, we've paid an immense price for the professionalization of sports, and in that sense, we're paying a pretty substantial price for the professionalism of medicine, if that's what it means, that we derive an income, regardless how handsome that income might be. We pay an immense price if what defines us as professionals is the income we derive from it, right? What's amateur mean? Amo, I love. What do you love? That's the real source of professional identity. That's really what it means to be a professional. What do you love? So in that sense, to draw a sharp distinction between amateurs and professionals is to dilute and contaminate our understanding of what a professional is or needs to be, right? So I hope we'll do a bit of thinking about what it means to be a professional. And we'll do that in the context of a mystery person, somebody we've all heard of, somebody who was born in Plano, Texas in 1971, Lance Gunderman, the son of a secretary and a newspaper route manager. His parents divorced when he was 2 years old. He was so bitter about that that after his mother remarried and he adopted his stepfather's surname, he's refused to this day to meet his biological father, right? He's so embittered that his biological father abandoned his mother that he has no interest in meeting his biological father. Who is our mystery person? Lance Armstrong, who won 7 consecutive Tour de France cycling titles, you know, a record that's unlikely to be equaled ever again. He won 7 times. Now, why would I mention Lance Armstrong? Because I'm seriously interested in the question, what do we mean by a professional? What is our understanding of the word professionalism? What's this? January 2013, just 3 short months ago, Lance Armstrong is Oprah's guest on the Oprah Winfrey Network. And we know in advance, prior to the conversation, that Lance Armstrong plans to confess, to come clean, so to speak, about his history of doping, the use of performance-enhancing drugs, in this case, to win cycling races. Oprah, in that interview, you can see it on YouTube or whatever, or Oprah Winfrey's website. Oprah says the USADA, what's that? The United States Anti-Doping Agency issued a 164-page report. The CEO of the USADA says, you and the U.S. Postal Team pulled off the most sophisticated, professional, and successful doping program sport has ever seen. Was it? Lance's response, no. It definitely was professional. It was definitely smart, if you want to call it that, but it was very conservative, very risk-averse, very aware of what mattered. One race mattered for me. What's the key clause, the key phrase here? It definitely was professional. I think most of us would say, that's right. They had the slickest doping program in the history of sport. They became rich, famous, and powerful by doping and avoiding detection. That was one professional cycling operation. Would we agree with that? If not, on what grounds could we possibly disagree? I think we live in an era when our understanding of the word, the idea of profession, professional, and professionalism is so diluted and so contaminated that we no longer know what the idea means. And as a result, our efforts to promote professionalism, let's say in the profession of medicine, are almost doomed from the outset. Right? Socrates, tell me, where does professionalism come from? Are we born with it? Is it something we acquire by chance? Can it be taught? How would Socrates respond to that question? He'd say, well, Meno, before we know where professionalism comes from, we first need to know what? What professionalism means. We spend thousands of hours checking off boxes. The LCME, the Liaison Committee on Medical Education, the ACGME, the Accreditation Council on Graduate Medical Education. I could go on. We spend thousands of hours checking off boxes that so-and-so exhibits professionalism. Most of us haven't a clue what that word means. We certainly can't teach or expect people to learn, at least from us, something we ourselves don't understand. So let's use the case of Lance Armstrong to think in some depth about professionalism. My goal here is not to provide the 4 defining criteria of professionalism or the 8 habits of highly professional people. My goal instead is, I hope, to provoke some serious reflection and perhaps conversation around the meaning of that term. October 25, 1996, Lance Armstrong is 25 years old. He's admitted to the hospital, coughing up blood. He has a large testicular mass. That's proven to be an embryonal carcinoma. Staging reveals both lung and brain metastases. So he has stage 4 non-seminomatous testicular cancer. The only hope for survival is surgery and chemotherapy. And at the time he's diagnosed, he's given a 40% chance of survival. There's a better than even odds that you'll be dead within a few years of this disease. What does Lance do? Well, he goes to the world's foremost center on the treatment of testicular cancer. And as he starts his treatment, he announces to the world, I want all of you to know that I intend to beat this disease, and further, I intend to ride again as a professional cyclist. That's a pretty bold declaration. Not only am I going to survive, but I'm going to return to the international field of competitive cycling. So he goes to Indiana University. Anybody recognize this guy? How many of us have read the most important book written in medicine in the last decade? This is alarming. You know, one of the nation's great medical schools, not a single person in the room has read the most important book published in medicine in the last 10 years. I'm aghast. Why do I say it's the most important? because it concerns the #1 cause of death of Americans under the age of 85 years, which is? Anybody know? You might think at one of the nation's great medical schools, people would know the #1 cause of death of Americans under the age of 85 years. On the other hand, you might be wrong. That's cancer, of course. What's the most important book written in medicine in the last 10 years? Won the Pulitzer Prize for general nonfiction in 2011. The Emperor of All Maladies, by a fellow in hematology and oncology named Sid Mukherjee, The Emperor of All Maladies, in which he tells many stories, but one is the story of this man. Who's he? That's Larry Einhorn, Lawrence Einhorn, the first person to use cisplatin in the treatment of testicular cancer, which turned a largely lethal disease into a largely curable disease. So Lance is going to be treated with multi-agent chemotherapy. You can see some of the agents, but Lance refuses one standard component of the regimen. You're not giving me bleomycin because of the pulmonary toxicity. I'll take my chances. I'm going to ride again. And in fact, I have to say, Lance isn't treated by Larry Einhorn, but by one of his colleagues, Craig Nichols. And we all know what happens, right? February 1997, CT scans and other imaging at our university shows that Lance is cancer-free. A year later, he's cycling again. And the year after that, he wins the first of 7 consecutive Tour de France championships. In 2005, he retires. In 2009, he returns to cycling and finishes 3rd at his final Tour de France race. A pretty amazing story. A guy given a 40% chance of survival from stage 4 cancer comes back and wins one of the world's most grueling athletic competitions 7 consecutive times, a feat never to be equaled. There's a lot to admire about this guy, right? He's an extraordinary human being by any account. And his single-minded pursuit of victory is in many respects quite admirable. Some of us in medicine, we like to win too. Some of us in medicine, we too can be pretty single-minded in the pursuit of our goals. These can be quite laudable characteristics. And Lance, reflecting on his disease, said, without cancer, I never would have won a single race. Cancer taught me a plan for more purposeful living. And that in turn taught me how to train and win more purposefully. We were talking about this in the break. Aeschylus, the Greek tragedian, said what? It is from suffering that wisdom comes. Right? John Donne, Devotions upon Emergent Occasions. Affliction is a treasure, and scarce any person hath enough. That if we understand suffering rightly, we recognize it can be the source of our greatest strength, our greatest insight. Lance Armstrong credits his suffering, his affliction, with having taught him among the most valuable lessons he ever learned. There's a powerful lesson in that. There's much to admire in this human being's resilience, his ability to bounce back even better from a terrible affliction, a human catastrophe. And I have to say, Lance is an incredible physical specimen. His physical fitness, his biological endowment is just about off the charts. Lance's maximal aerobic capacity was measured at roughly 84. the average very fit fourth-year medical student, member of AOA, to be inducted this evening, would have a physical fitness on the aerobic capacity on the order of 40 to 50. Although I have to tell you, the highest recorded human aerobic capacity in history belonged to that man. Lance didn't have the same aerobic capacity as he does. Who's that? Yeah, that's Greg LeMond. So Lance didn't just win because he was the fittest person in history, but he's darn close to it. And you know, when Lance was competing, he had a resting heart rate of 30 and a maximal heart rate of over 200. Pretty incredible. There's something to admire in that, right? Somebody who can stay awake for 36 hours and still make terrific decisions. There's something inherently admirable about somebody who can work that hard for that long and still perform at a very high level. But of course, Lance was dogged throughout his career with allegations of doping. Lance used to say proudly, "I've taken over 600 drug tests and never failed a single one." And by the way, that's still true. Lance has taken over 600 drug tests and never failed a single one. His record stands. And Lance used to say, "Hey, I'm the most tested athlete in the world." He may well have been right about that. But you know, somebody else in cycling, and imagine what this meant to Lance Armstrong, said, "You know, there's a cancer in cycling," with clear allusions to Lance Armstrong. There is a cancer in cycling. Somebody's cheating. Somebody's eating away at the ethos, the professionalism of our sport. A cancer. And that cancer is named Lance Armstrong. In response to those allegations, Lance Armstrong says, "You know what? I have zero tolerance for anyone using or prescribing performance-enhancing drugs." What's going on here? This is a strange tale. And of course, we all know the denouement, right? So some years ago, the United Kingdom Sunday Times prints allegations from LA Confidential that Lance Armstrong is involved in a doping scheme. Lance sues the Sunday Times for libel. There's a multi-million-pound settlement out of court. Now, after Lance admits or refuses to contest that he has been involved in doping, late last year, the Times sued him to recoup the value of that settlement plus their attorney's fees. That's very unlikely to be successful, but that's what's happening. So I want to reiterate this. October 2012, the USADA, anti-doping agency, says Lance Armstrong enforced the most sophisticated, professionalized, and successful doping program not that cycling has ever seen, or swimming has ever seen, or weightlifting, or bodybuilding, or professional football, or baseball has ever seen, but that sport has ever seen. And of course, it was this year in January that Lance Armstrong admitted, in a sense, that that was true. Although, and he said, I think proudly, it is the most professionalized doping program. Nobody's ever done it better than we did. We are the poster children for professionalism in doping. What do you think he meant by that? What would be his criteria for professionalism if his was indeed the most professionalized program ever? Anybody? Avoiding detection. What do you mean good at it? What do you mean good? Yeah, but what do you mean a pro? Socrates wouldn't stand for that as an explanation. What do you mean a pro? Oh, Okay, so he's good at separating technical proficiency from the ethics or morality of what he's doing. And he's good at avoiding detection. Anything else? The most professional program sport has ever seen. Anything else Lance might have in mind? Well, this alone is interesting. Avoiding detection, separating the morality from the technical success of the enterprise, the financial success of the enterprise. By the way, how much is Lance Armstrong worth today? What's the net worth of Lance Armstrong? Anybody? Oh, what? The answer, best estimate, Forbes, $125 million. Poor kid from Plano, Texas. I mean, by Oprah standards, not that good. But by the standards of most physicians, at least the ones I know, 125 million is not bad. You know? What would be the median lifetime earnings? What would be the median lifetime earnings of U.S. physicians? What do you think? Or how about this? What's the median net worth of U.S. physicians age 65? $3 million? Let's say $3 million. Lance got more than 40 times that much. He puts the doctors among us to shame, right? How many physicians are there on faculty of Case Western who have a net worth in excess of $100 million? What do you think, Jeff? 6 or 8. Yeah, that's not bad. You can play ball with the big boys. What if I told you the answer is 0? Nobody's even close. I mean, this guy's a pro, right? He's a pro. $125 million. What do you think?
Well, I was going to say expertise or knowledge.
Expertise. I think Lance probably knew more about doping than just about any professional athlete there is or has ever been. I mean, we don't really know that. We don't have evidence for that, but it seems like an eminently reasonable assertion. Avoiding detection, separating the morality from the technique, the technical success, and, how would you put it?
Knowledge or expertise.
Expertise. The guy is a pro. Nobody knows more about it than he does. That's what we mean by professionalism in medicine, right? All doctors make mistakes. I've never been sued. I'm a pro. Right? I've made mistakes. Never been sued. You know? I've never been brought before the ethics committee, right? Right? That doesn't necessarily mean I'm ethical, but, you know, I've made a lot of money, published some papers, whatever. I'm not so worried about the morality. As long as I don't get in trouble, I'm okay. And people think I know a lot, rightly or wrongly. I'm a pro. Gunderman's a pro, you know? Hey, that Gunderman guy, what do you think about him? He's a pro, you know? Is that okay? I'm not so sure. Lance to Oprah, I'm a flawed character. I viewed this situation as one big lie that I repeated a lot of times. Medicine's not about the money. Medicine's not about the money. Medicine is not about the money. Show me the money. Right? You remember Jerry Maguire? Cuba Gooding Jr.? Show me the money, right? Hey, I'm out on the job. You know, I'm looking for a job. You'd be stupid to negotiate about a job if you didn't talk money. So, you know, I mouth the platitude that I don't really care about money. I'm in it, you know, for my patients, for the profession. But when push comes to shove, show me the money. That becomes the one lie that I repeat over and over, right? That's what Lance thought. Hey, one time they asked me, are you doping? What am I going to say? I said no. At that point, I was committed. I didn't tell 1,000 lies. I told one lie that, you know, I had no choice but to repeat 1,000 times. Totally different. The magnitude of the lie is still a 1. It's just, 1 times 1,000, but that's not so bad as telling 1,000 lies. I'm a guy who expected to get whatever he wanted and control every outcome. Yeah? Sound like any doctors, I expected to get whatever I wanted and to control every outcome. What's that? Are those the words of a professional? To get what I wanted? Here's the question, is Alpha Omega Alpha? The medical school at Case Western, the hospital, the health system, the profession of medicine, is it a springboard to your success? Is it a way for you to get what you want? Right? I want to make money. I want to become powerful. I want to be associate chair and then associate dean and then president or CEO. I'm on my way up. And I need these organizations as stepping stones. Right? As rungs on the ladder of my success. That's what I'm here for. Right? This is about me. I expect to get whatever I want. And I'll use the organizations, the institutions, the people around me in pursuit of that goal. People who know Lance say he was like that, You were either on his team or you were out. And if you were on his team, that meant, what's it going to take for Lance to win? Our whole purpose here is to make sure Lance wins. That's what Team Armstrong is all about. What's the problem? It's this ruthless desire to win at all costs. Serves me well on the bike, served me well fighting testicular cancer, but it got too out of hand, right? That defiance, that attitude, that arrogance, you can't deny it. Healthcare reform. Is it good for doctors? Right? Healthcare reform. What's it going to do to my pocketbook? Give me the answer to that question, and I'll tell you how I feel about healthcare reform. Right? Everything's about me. Is it good for me? Does it enhance my wealth, my power, my fame? That's the litmus test, right? I'm for it or against it based on that litmus test. That's arrogance. The antithesis of professionalism in medicine might be something like arrogance or hubris or overweening pride. This is about me. Everything else is secondary, a means to my end. That might be the antithesis of professionalism. So we've seen this slide before. The most sophisticated, professional, successful program. Was it? No. It definitely was professional. That clause is a symptom of our times. Because most people hear that and they say, Lance, you're right. It was slick. It was successful. It was professional. And I want these young doctors to learn professionalism. Right? And that means, essentially, they know a lot, they're technically highly proficient, and if they do something wrong, nobody's going to detect them. You know what that is? That's a shallow, empty, deeply misguided notion of what it means to be a professional. And it's the symptom of our age. You would think doctors would be out in front promoting a serious conversation around what it means to be a professional. Serious conversations about what professionalism means to medicine, or to law, or to divinity. Pick other professions. What does professionalism mean? We're not having those conversations. We're ticking off boxes. Does so-and-so exhibit professionalism? Well, you know, he parts his hair on the left. I shouldn't give that example. He double knots his tie appropriately. You know, she doesn't have any body piercings, at least not that I can see. Check. Move on to the next box. What did I say? Shallow, empty, deeply misguided, uninformed, ignorant conception of what it means to be a professional. Whatever professionalism is, it doesn't mean primarily avoiding wrongdoing or detection or punishment. How about this? The fact you never get sued, the fact your name is never brought before the disciplinary committee tells us next to nothing, not nothing, next to nothing about the degree to which you exemplify professionalism. None of us can hold up our hands and say, look at me, I never got in trouble. Exemplar of professionalism. Baloney. Nothing could be further from the truth. Professionalism is not primarily about what we avoid. It's primarily about what we seek. Some might say what we love. Where your heart is, there also will be your professionalism. You know, professionalism is an expression of what's in our heart. Who's he? Probably the most admired physician in American history. Who's he? That's William Osler, graduate of McGill and trained at Penn and Hopkins, went on to become what? Pretty unusual for an American. What did Osler become? The Regius Professor of Medicine at Oxford. That means the king invited him to become the professor of medicine at Oxford. Not bad for a guy from North America. By the way, he was Canadian. But Canada's part of North America. Osler said 100 years ago, woe unto medicine when medicine begins to think that professionalism is technical. Medicine is not technical. Professionalism in medicine is not primarily technical. It's not a matter of how well you score on that multiple choice exam. It's not a matter of, how effectively you can perform some procedure, let's say involving hand-eye coordination. It's a matter of humanity. It's not how proficient are you, it's how human are you. Right? It's the humanity of the physician that's going to determine professionalism in medicine. There's Osler, teaching at Hopkins. You are in this profession as a calling, not a business. As a calling which exacts from you at every turn self-sacrifice, devotion, love, and tenderness to your fellow men. Once you get down to a purely business level, your influence is gone and the true light of your life is dimmed. You must work in the missionary spirit, with a breadth of charity that raises you far above the petty jealousies of life. What do you think he means, missionary spirit? When in a pinch, turn to American cinema. Anybody know the cinematic locus classicus on this point? Jake and Elwood. Anybody know who Jake and Elwood are? The Blues Brothers. Jake and Elwood Blues. That's right. Portrayed by John Belushi and Dan Aykroyd. Excellent. What were the Blues Brothers up to? What? Yeah, people would ask them, what do you think you're doing? They responded, we're on a mission from God. That's funny. But you know why it's funny? Because like everything that's funny, It's about something that's dead serious. How many people in medicine today feel that we're on a mission from God? Talk to Maimonides. Talk to Hippocrates. Talk to William Osler. I mean, we may be in an age where you can't even swear an oath anymore. Yeah, I mean, it's, the white coat ceremony, it's graduation, everybody stands up, everybody holds their hand up, everybody, I don't want to look stupid, like some kind of party pooper, so I'll mouth those words too. I swear by Apollo and Asclepius, and psh. Everybody knows we're just going through the motions here. We live in a post-oath-taking age. What could we possibly swear to? I swear by my medical license. I swear by my medical diploma. I swear by my board certification. I swear by my pay stub and my retirement plan and my investment portfolio. I'm not going to do anything that would cost me this job because it means a lot to me. It pays the bills. We may live in an age where we're past the taking of oaths. But, from Osler's point of view, if you're going to take an oath, you need to be operating with something like the missionary spirit. I'm on a mission. Some people may not want to say it from God, but I'm on a mission in pursuit of something higher, in service of something greater. You can define the behaviors of professionalism till you're blue in the face. But if it's not animated by that spirit, I would submit to you, it's basically a waste of time. You may cut your medical malpractice litigation rate. You may appear less frequently before some disciplinary committee, but it's not emanating from the right source. You're not drawing from the right well. And basically, it's an act. It's a costume that you put on, 8 to 5, 7 to 6, 5 days a week, 7 days a week. It's not really who I am. It doesn't really reflect who I care about. It's a kind of sham. 600 drug tests, never failed one. I have zero tolerance for people using or prescribing prohibited substances. It's a sham. It's an act. We're pretending to be something we're not. You're too good to go through your career, your residency, the rest of this week perpetrating a fraud. First on the rest of us, but most importantly on yourself. You're too good for that. You have too much potential to tolerate that for even a single day. The real challenge of professionalism is to operate from the missionary spirit. $125 million. 7 world championships. See the fingers there? What's that about? 7, right? This is number 7. Wealth, power, fame. One of the most famous athletes, one of the most famous people in the world. Is that professionalism? 4 low-quality photographs of Sir William Osler at the bedside of a patient. Both those people became famous, but for very different reasons. The contrast between there's much to admire about Lance Armstrong, let's be honest. But there's something deeply problematic about Lance Armstrong as an exemplar of professionalism. Whatever he did, it may have been highly successful, but it was not professional. It was a finger in the eye, a poke in the eye of what it means to be a professional. Have we forgotten the meaning of professionalism? I'm not sure many of us ever understood the meaning of professionalism. how are we going to discover or recover the meaning of professionalism? I think the answer is we need to think about it and talk about it. One of the best things you can do, I think, is to stimulate real conversations. What do you mean medicine is a profession? What do you mean I'm becoming a professional? What do you mean I'm supposed to be an exemplar of professionalism around my patients, my colleagues, my community? What exactly does that mean? That's a conversation we desperately need to have today. I think I'm going to stop there. The goal of giving a presentation like this is the hope that it'll foster some, certainly reflection, but also conversation. Undoubtedly, I got some things wrong. I just don't know which ones they are. So perhaps you can help set us all straight. As you can imagine, it would be a crushing blow to bare your soul in this way and have it meet with a deafening silence, which is meant as an appeal to the compassion of inherently compassionate people, fellow health professionals, physicians, who surely wouldn't want to see a colleague in this state of embarrassment and would rush to his aid. Please, would you say who you are?
My name is John Fanaro. I'm a neonatologist. I really enjoyed your presentation. It gets me thinking, Osler practiced in such a different time and a different environment. We work in a very different and changing environment. And so I'm trying to think about how would Osler handle today's pressures of RVUs when we could be, what that picture shows him spending a lot of time at the bedside. How does it work when he's supposed to do a 15-minute visit?
It's a terrific question. There are lots of different ways to approach it. Here's one. Actually, there's an article coming out in a journal in a few months. It's called Are Current Changes Unprecedented? Because I think one of the most frequently abused words in contemporary conversation, at least in healthcare, is unprecedented. Healthcare costs are rising at an unprecedented rate. You know, dissatisfaction with healthcare is at unprecedented levels. The pace of change is unprecedented. And, you know, that's all true. Things really are changing. You'd have to be blind or stupid not to recognize that. But I'll tell you, one of our most serious disabilities in medicine today stems from a lack of historical understanding. You may disagree with me, but I'm going to say this. American healthcare was changing more rapidly in 1935 than it's changing in 2013. American healthcare was changing more rapidly in 1946 than it's changing in 2013. Right? Things called world wars. You might disagree with me. I might be wrong. But I have a deep conviction that we are not, in fact, at the most difficult period in the history of American medicine. There are many challenges. But one thing, and by the way, you didn't say things are unprecedented, so this isn't meant as a corrective to your question at all. But one important thing is to recognize we've been down these kind of roads before. Physician incomes are at an all-time high. Talk to your colleagues in Europe or China about the incomes of physicians in the United States today. Talk to the people who are in your field 30 years ago about physician incomes today. We face many challenges. We also are in a period of unprecedented prosperity. Doctors have basically never had it so good. Our incomes have never been so high in real terms as they've at least been in the very recent past, and more or less remain so today. Yeah, we face a kind of crisis, but things have been worse. One thing we need to recognize is how good things are. Once we recognize that, we need to ask ourselves the question, what are we doing to deserve the great good fortune we currently enjoy? And if the answer is we're engaged primarily in a rearguard action to protect the legacy that our predecessors have bestowed on us, then shame on us. You know, the real question would be, what are you and I doing to deserve? I can order a CAT scan. You know, I can perform a laparoscopic surgery. I can pull down $500,000 a year. Do I deserve that? In what sense do I deserve that? What could I be doing to deserve such good fortune even more? Right? What did Confucius, Kung Fu Tzu, say on this matter? Those who seek the good of others have done the most to secure their own. You know, the real question is, how can I get more or keep more for myself? How can I contribute more to other people? And if we ask ourselves that question every day, how can I contribute to the fullest extent possible to my patients, their families, my colleagues, the medical school, the profession of medicine? This sounds crazy. How can I contribute the most to them? I think we will in fact find ourselves inadvertently doing the most we can to secure the good life we enjoy today as physicians. That's not directly responsive to your question, but it's at least dancing around an important perimeter of it, I think. Please, Jeff.
So as I listen to you, I look at a reality that occurs in this city, and I think that doctors in all their professions, most advanced to the least advanced, have a tremendous internal desire to be professional and do good. Unfortunately, we work in a business model that makes us comply with the business model and work fast and make money. We have a free clinic system here in the city. One is a free clinic, other is MedWorks, and other ones where we ask for doctors to come out on their spare time and do these mass clinics for uninsured or underinsured people. We have so many doctors volunteering, and they come from all aspects of the medical societies, from private practice, from the Cleveland Clinic, University Hospitals, Metro. Some of them are the chief of cardiology of the Cleveland Clinic, etc. And they stand side by side, and they do primary care practice in their own time and work like mules. The reason they do that is because it makes them feel, as you described, as professionals. It's a time when they're giving of what they can give. They're forced to work all week long in the paradigm of making money. But medicine teaches you, and we still teach the students, that there's something you get back from giving to others. And I think that is imbued in our ethic of medicine that makes us different from other professions.
That's terrific. So an old phrase, some of us have heard it before, we make a living by what we get, but we make a life by what we give. We are desperately hungry, not only as physicians, but as human beings, to make a difference, to give our very best, the best of which we're capable, to make a difference in the lives of other people, to leave our best behind. I didn't hold anything back. When all was said and done, I gave it all. I laid it all on the table, all on the line. That's the kind of life we all want to lead. We're desperate for opportunities to give. If you can be one person who recognizes that deep hunger that virtually all of us share, and then serve as a catalyst for helping us recognize that and express it as well as we possibly can, you are a leader in medicine. You will make a big difference for a whole lot of the rest of us who are struggling to find the words to express that, to find practical means to put that into action. If you can be a catalyst through a free clinic, let's say, who helps the rest of us come closer to that, get more in touch from that, draw to a greater degree from that wellspring of inspiration and fulfillment, you are a leader in medicine. And you're leading us in the right direction. And boy, that wouldn't be a bad role to aspire to in our field, that you're going to be one of those catalytic figures who helps bring out the best in the rest of us. And I'll tell you, it doesn't stop there. If you feel that way, you have a moral obligation to serve as an effective advocate for what you know really matters. So if the associate chair or the associate dean or the dean, or the vice president of this or the COO or the CFO of that engages you in conversation and says, look here, you're not meeting your numbers, or here's a tremendous revenue enhancement possibility. I'm not saying you say, oh, I can't discuss that. I'm not going to soil my hands, with sordid discussions about business or something like that. Far from it. But in that conversation, you need to be an effective advocate. In effect, you need to testify to what you know really matters most about the profession of medicine and the way we aspire to care for our patients. Too many of us are silent. Somebody says, look, you're not meeting your numbers. We say, oh, tell me what to do. I don't want to lose my job. I don't want to take a cut in pay. Tell me what I have to do. Show me the dashboard I have to monitor all the time, right? Throughput, RVUs, error rates, whatever. Show me the dashboard. I'll do whatever you say. That's what a lot of doctors say, right? We need to say, yeah, that's important, but guess what? There are other things that are important. Let me tell you a story about what happened in my clinic last Thursday. Let me tell you a story about what happened yesterday in the ICU. You see the numbers, and that's a good thing. But we doctors need to see more than just numbers. And the best way for me to convey to you the importance of that reality is to share with you a story about when a doctor really made a difference in the life of a patient. We've got to be effective advocates for that perspective. Because you go get a master's in health administration or a master's in business administration, you're not going to take a course on that. You're not going to write a paper on that. That's what doctors and nurses, other health professionals, that's what doctors need to be advocates for. If we don't do it, nobody else will. Are we okay on time? I'm not the master of ceremonies here. I don't know. Let's take one more question or comment, please.
Peter Whitehouse, I'm a geriatric neurologist, and I'm not really making my numbers, and I'm about to move my practice to a garden.
To a what?
Garden.
Wow, okay.
My wife and I started a public school, and I think we've lost our conception about what health is. And that if we wanted to improve the health of this city and the world, we actually put more money in public education, including hospitals. But to your comments, I do think language is important. I think the word professionalism has gotten lost. I actually think we've lost stories, too, because you just talked, we have demeaned narrative to make it an anecdote. And we are worshiping two dominant religions in medicine. There is a spiritual tradition in medicine. It's called scientism and capitalism. And when they're allied, that's a very powerful religion. The question I have for you, though, is, yes, we bear some responsibilities because as professionals, we're violating the social contract that was the basis of what we started as a profession. But we're doing that in a world that is basically doing that to itself. The world itself, somebody said, and you see what every wise person says, that societies get the healthcare systems that mirror their own values. So part of the reason, not to take the responsibility away from doctors at all, is that the society at large has distorted these values. And we've allowed money and models of health that are connected to money to dominate what we think health is all about.
That's a great point. Traditionally, in public opinion polls by firms like Gallup, the two most respected professions in our society have been scientists and physicians. Physicians have been falling off the curve to an alarming degree. What's now the most respected profession in our society? Nursing. Their grades weren't as good. They didn't spend as long in school. Their scope of practice is much more, in a sense, narrowly defined. They can't do surgery or prescribe medicines. Why would nurses be the most respected professionals in our society? Knowledge, technique, power in a certain sense. They're doctors' inferiors in very important respects. Why would they be the most respected? And trusted, by the way. Yeah, something like people believe they put the patients first. They still care for the patients. They still lay hands on the patients. They not only care for, they care about the patients. People wonder about doctors today, right? They drive around town, they see the billboards. You know, injured in an accident, right? Call so-and-so. You know, want the best obstetrical care? You know, call so-and-so. What's the message we send to people today? Who's formulating that message? I think this is, you're right. The anecdote is at the bottom of the evidentiary hierarchy. What I want is biostatistically analyzed data. That's what counts. A story, that doesn't tell you anything. Might be entertaining, might be humorous, but there's no knowledge from that. Baloney. To be a professional means that your core is defined by stories. What story do you tell yourself every day? God, I hate parking around here. You know, it's tough to park around here. You know, I hate the people I'm working with. I hate the way I'm having to practice medicine today. I hate the fact that my income is dropping. I hate the fact that doctors are losing autonomy. I hate the fact that people in Washington are telling me how to practice medicine. Right? Hate, 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 hate. Misery, 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 despair, 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 impotence, impotence, impotence. Right? A lot of us tell ourselves that story all the time. You know, the counsel of despair. We talked about this before. Figure out something you did that really made a difference. When you really felt alive as a physician. May have been founding a school. Anybody know what the word doctor means? Comes from the Latin. To teach. Doctors are educators. When was the last time you educated the CEO of your hospital? The chair of your department? The dean of your medical school? The farther you get from patients, the less tightly tethered you are to what really matters in medicine. The people leading medicine, at least at institutional levels, tend to be quite far removed from patients. That creates a tremendous professional obligation for you to keep educating those people about the lessons you're learning, the stories you're gleaning from the care of patients. Right? If there's a hope for medicine, it's that doctors will begin telling effectively, early, often, and well, the stories of what really matters in medicine. That's the last best hope for professionalism in our field. And happily, it's something every single one of us can do. Doesn't matter what degrees you have, what titles are on your business card, what's on your CV, what your annual income is. Every single physician has the full prerogative to tell the stories of what matters most in medicine. If we can get enough people attending to those stories and telling them, we can make a big difference. We can make a big difference in healthcare. We can make a big difference in professionalism in medicine. We could make a big difference in our own lives. If we tell ourselves crappy stories, we will lead crappy lives. If we learn how to tell ourselves really deep and rich stories, we at least have a chance to lead deep and rich lives. I think that's what professionalism is finally all about. Thanks a lot for your attention. I've enjoyed it a lot.